Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everybody, welcome to episode 90 of the Hair Loss Show. I'm Dr. Russell Knudsen.
I'm Dr. Vikram Jayaprakash. Welcome back. Thanks again for watching. Last episode we talked about giga sessions, and so I think that's a great segue onto the next topic, which is about dense packing. Right. And so last time we talked about Facebook groups and forums, and some of the commentary that I see on that is like, oh, listen, I'm going for a hair transplant and I really want to make sure I get 60 grafts per square centimeter or 50 grafts per square centimeter, or I get in clinic, Doc, we're gonna have a transplant. How many grafts can you do per square centimeter? What's your answer? What's your answer to that question?
Well, I mean, probably the most extreme example of this was an engineer who once brought me in a CAD calculation that he'd done on his computer with the different areas and the different densities he wanted in the different areas, and he'd calculated out exactly how many grafts he wanted and needed. So let's give just a very quick history lesson. Basically, dense packing, I suppose, practically is about how many hairs per square centimetre you end up with. When we had bigger grafts, particularly back in the day of big plugs, which is 40, 30 years ago, you had a lot of hair per square centimetre because you were planting 15 to 20 at a time, and as you put the plug in, they compressed, and that's what really accentuated the doll's head look back then. But it didn't look good because it was not an even distribution. In fact, a lesser density with an even distribution looks better than a greater density with uneven distribution. So as the grafts have got smaller, so has the slits or the holes we made to put the grafts in. Now, one of the big considerations for us as surgeons is blood supply of the scalp. Now, the blood supply of the scalp is very good and it is generally very forgiving, but it's not totally forgiving. So there are certain areas, because of the way blood comes into the scalp, which is from the face or from the neck, the area in the center of the top of the scalp is really an overflow area where blood's coming in from different sides and just sort of meeting here. And that's the area where surgeons get themselves into trouble with dense packing. And we see a few examples of this, thankfully not many, a few examples of this where skin starts to shed and scarring occurs and loss of grafts because they've overwhelmed the blood supply. So that's a word of caution about dense packing. You need to be careful. The other thing that I'd say about dense packing before we go through it in a bit more detail is that when patients come in and ask for 50 or 55 or 60, they're comparing us with somebody else, or they've gone to a discussion board or a group where someone said, I went and had this done. It doesn't make sense that every patient is treated the same way. So for example, different patients have different donor density, meaning how many hairs they have per square centimetre back here varies significantly between patients. So does the quality of the hair. So if you've got coarse hair versus fine hair, that makes a big difference visually. In terms of outcome, you don't need the same number of hairs to get the same kind of improvement.
Hair as well.
Curly hair is particularly helpful. Lighter hair to scalp variation colours is helpful. So the way to think about it is that every patient is an individual and there's no mathematical formula that you use that's the same for every particular person. So even though dense packing sounds sensible, it's not necessarily sensible. The other area where I know I'm sounding a bit negative about this, that I don't like dense packing, is when people are future-proofing their patients. And what I mean by that is that if you've got a bald area, you can put the hair that you want in there and you know what the result's going to be. If you've got a thinning area and you put the grafts in, then be careful about whether you're overwhelming the blood supply for the surrounding hairs and accelerating their demise. And that certainly can happen. But this future-proofing concept is where the doctor says, well, you're going to lose that hair in future, so we'll just pack them in now, and then when those hairs are lost, you'll still have a decent amount of hair. Now, philosophically, I just can't agree with that.
I refuse that, and I say, listen, you can't. If there's a hair, you can't put another hair on top of it. You've got to kill that hair in that process to try and do it. So I'm 100% with you on that.
So, I mean, patients like the idea of this single operation, right? For example, I don't have to come back. But it's not how it works, right? With baldness, it's a progressive condition, and we treat what we see, not what we think we're going to see down the track. So I would say that dense packing to a degree, makes sense in high priority areas that are bald. And so what I'm saying about that is that for most patients, they really want to have a strong hairline. So I think you've got to do a decent amount of density at the hairline. And I also like to have good density in this central forelock area here, because the head's a dome. That's where the light shines off the dome. That's usually the most see-through point. If we've used 3,000 grafts on the front of the head and they've got a bald crown, we are not going to be able to do the crown to the same density that we do the frontal hair, for two reasons. Number one, we're going to run out of grafts. But number two, in the crown, the hair splays through 360 degrees, whereas on the front half, we're more or less planting in the same direction, so you're getting an overlap effect. So you visually can't achieve that. I mean, patients hate seeing, thinning in the crown whirl, and they're always asking us what we can do about it. But it's the hardest thing to fix.
Yes.
Because it just sucks in an awful lot of grafts.
That's why it's called the black hole of hair transplant.
Right. It sucks in a lot of grafts without really necessarily giving a patient a big benefit, other than the comfort of having that area a bit thicker. So I make no apologies for both of us having the philosophy that we're conservative about it. We don't aim for a specific number in an area.
See, that's the other thing. I never measure. I've never gone with a ruler and gone, here's 1 centimeter and how many grafts. I never go, right, I'm aiming for this. Because I think that's just too prescriptive. You lose the artistry in that whole thing, because you're trying to even out. I know you're trying to create
the illusion of density.
That's right. And so, but it's about trying to create that evenness and that seamless flow from left to right on the scalp. But also, you've got to take into account that grafts, if you say so many grafts per centimeter, grafts come in 1, 2, 3, 4 hair follicular units.
Yep.
And so I don't think it's necessarily comparing apples with apples if you're doing
an area. There's no real point in having a very high density pass of grafts if the survival rate decreases because you've overwhelmed the area. So again, this is a delicate dance, right? It's a delicate dance.
And if you've got someone who's diabetic, who smokes, then you kind of want to be a little bit more gentle in terms of trying to pack the density, because those conditions will impair blood supply to the scalp.
And the other thing is, take into account, like if I see an area that's thinner and an area that's thicker, I'm going to do more in the thinner area and less in the thicker area, right? Rather than just using this formula, as you said. So, yes, you're right. The idea is to create the evenness aspect of it. And even if it's a little bit thinner than the patient might want at the start of the process, the very fact that you've evened it out makes a huge difference to the visual outcome.
Great. Okay, there you go. That's dense packing for you. Hopefully that sort of cleared up some of the issues associated with that, and you found that useful. Thanks again for watching. Please remember to like and subscribe for the channel, and we'll see you again on the next episode.
And thanks very much.